Let me tell you what is going to happen in the next 30 minutes. I'm going to walk you through 5 specific research-backed, scientifically documented causes of persistent throat mucus in adults over the age of 55. Not vague lifestyle advice. Not drink more water and call your doctor. Real biology, real explanations, real causes, and this is the part most health videos will never do, I'm going to tell you which 2 of these causes are almost certainly happening in your body at the same time, right now, and why that combination is making everything dramatically, exponentially worse. I am also going to give you an action plan, step by step, tonight, tomorrow morning, this week, specific things you can begin doing immediately, most of them completely free, that research supports as effective. I work in preventive health and senior wellness, and I have spent years watching people carry this symptom quietly, being dismissed, handed throat lozenges, and told it was just part of getting older. It is not. And every single person I have ever seen turn this around started by understanding exactly what we're going to talk about today. Before we go any further, drop a comment right now and tell me, is your throat mucus worse first thing in the morning, or does it stay with you throughout the entire day? Right morning, or all day, in the comments. That one answer tells me more about the root cause in your specific body than almost anything else. I read every single comment personally. All right, let us get into this. Starting with a piece of biology that almost nobody in your life has ever explained to you, and that once you understand it, will make everything else fall into place perfectly. Segment 1. The Biology Foundation, minutes 3:30 to 7 o'clock. Here is something your body is doing right now that you have never once had to think about, and that is a miracle in itself. At this very moment, the tissues lining your airways, your throat, your nasal passages, the delicate tunnels that carry air in and out of your lungs, they are producing mucus, continuously, around the clock, every hour of every day, whether you are awake or asleep. And that is completely, perfectly, healthily normal. Here is what mucus actually does. It is your body's internal armor system for your breathing passages. It is sticky by design, catching bacteria, viruses, dust particles, and allergens before they can travel deeper into your lungs. It keeps the fragile tissue lining your airway moist, pliable, and resilient. It even contains immune molecules that begin neutralizing harmful invaders on contact. Mucus is not the enemy. Mucus is one of your body's most loyal defenders. So what is the problem? Why does it accumulate? Why does it sit there, thick and stubborn and miserable? The answer comes down to a system most people have never heard of, and yet it works in your body millions of times every single day. It is called mucociliary clearance, running along the walls of your entire respiratory tract. Your throat, your nasal passages, your trachea, are millions upon millions of microscopic hair-like structures. They are called cilia. They are so small they are invisible to the naked eye, but their job is one of the most critical functions your breathing system performs. These tiny hairs beat rhythmically, in perfectly coordinated waves, sweeping mucus upward and outward in a constant, fluid motion, keeping it thin, keeping it moving, never letting it pool or collect anywhere. In a healthy young adult, this system is so efficient that mucus is produced and cleared almost before you ever notice it exists. But here is what the research shows clearly, and what almost no one tells older adults. As we age, the cilia slow down. They beat less frequently. They become less coordinated. Their sweeping motion becomes less powerful. The result is that mucus that would have been cleared in a matter of seconds at age 35 can sit and accumulate for hours at age 65 or 70. That is not a criticism of aging. That is simply physiology. But it means something very important for everything we're going to discuss today. Any factor in your life that is pushing your body toward excess mucus production is going to hit you harder and last longer than it would have hit a younger person. That explains why your neighbor's child had a runny nose for 2 days, and you have been dealing with this for 2 years. That explains why every remedy seems to work temporarily and then stop. And that explains why addressing the root cause, not just managing symptoms, is the only strategy that actually works. Now, with that foundation in place, let us go through the 5 causes. And I want you to hold each one up against your own experience as I explain it. Cause 1, Silent reflux, minutes 7 to 12 o'clock. Laryngopharyngeal reflux, the invisible fire in your throat. The first cause is the one I most urgently want you to understand, because research consistently identifies it as the most frequently missed explanation for persistent throat mucus in this age group. It hides in plain sight. It mimics other conditions. And the reason most people never discover it is that it comes with none of the warning signs we have been taught to expect. It is called laryngopharyngeal reflux. You may never have heard that term before. Let me give it to you in plain language. Most people understand heartburn, that burning, uncomfortable sensation in the chest after a heavy meal. That is what we typically call acid reflux. Stomach acid traveling backward up the esophagus and causing irritation. Unpleasant but recognizable. It announces itself. What I am talking about is something entirely different. Something far quieter and far more deceptive. There's a muscular ring, a valve, located at the junction where your esophagus meets your stomach. Its one and only function is to stay tightly closed after you eat, ensuring that stomach contents, including highly corrosive digestive acid, remain locked in the stomach where they belong. Over decades, that valve can gradually lose its muscle tone. Think of a rubber band that has been stretched and released thousands of times. Over time, it no longer snaps back the way it once did. The valve becomes loose, imprecise, and when that happens, stomach acid does not merely creep into the lower esophagus. It travels all the way up past the esophagus, into the throat, into the larynx, the structure that houses your vocal cords, sometimes all the way into the nasal passages. Now here's a biological detail that makes this so clinically significant. Your esophagus has a protective lining that is specifically designed to handle occasional acid exposure. Your throat does not. The tissue lining your throat is exquisitely sensitive. Even a microscopic trace of acid touching that tissue triggers an immediate, powerful protective response from your immune system. Your body rushes mucus to the site. Thick, coating mucus, designed to protect and soothe the irritated tissue. And if this is happening repeatedly, every night while you sleep, hour after hour, as stomach acid silently creeps into your throat, you wake up every single morning to that familiar, oppressive heaviness at the back of your throat, and you have absolutely no idea why. Because there was no chest pain, no burning, no digestive discomfort whatsoever to point you toward your stomach as the source. Clinical literature in ear, nose, and throat medicine has established that up to half of people with this condition report zero heartburn. None. The only signs on the throat: chronic throat clearing, a rough or strained voice in the mornings, the sensation of something always sitting there, mucus that starts accumulating before you have even gotten out of bed. Ask yourself honestly right now, is your throat noticeably worse in the morning than it is by midday? Does it worsen when you bend forward or lie down after eating? Has your voice sounded different, rougher, when you first wake up? Do you find yourself clearing your throat constantly without it ever fully clearing? These are the fingerprints of silent reflux. And they are fingerprints that most people spend years misreading as a throat problem rather than recognizing them as a stomach problem, wearing a very convincing disguise. Host pauses, leans slightly forward. One additional note here that is genuinely important. If you regularly take non-steroidal anti-inflammatory medications, ibuprofen, naproxen, aspirin, for joint pain, arthritis, or chronic discomfort, peer-reviewed pharmacological research has firmly established that this class of drugs reduces the stomach's own protective lining. Its ability to defend itself against its own acid is compromised. That makes acid reflux, including the silent variety traveling up to your throat, significantly more likely to develop or worsen over time. If you take these medications regularly and your throat has been persistently symptomatic, that is a connection you should raise specifically and directly with your physician, not as an afterthought. As the main item on the agenda, small smile. Before we go to cause number 2, pause for a second and tell me your name in the comments. Tell me where you are watching from. I genuinely want to know who I am speaking to and supporting here. This is a real community, and every person in it matters. Cause 2, postnasal drip, minutes 12 to 16:30. The invisible drain, chronic sinus inflammation. The second cause is one that arrives so quietly so gradually that most people living with it do not even realize it is a separate issue from the first one we just discussed. And yet it is. And the reason I'm giving it its own full section is that for many of you, this can cause number one are working together, layering on top of each other, and understanding both is essential to actually turning things around. When most people think of sinus problems, they imagine the dramatic version: intense facial pressure, a throbbing headache that wakes you at 3 in the morning, a nose so completely blocked you have to breathe through your mouth just to function, a full-blown, unmistakable sinus infection. But chronic sinus inflammation in adults over 55 very rarely looks like that. It presents almost invisibly. Breathing feels mostly normal. No significant pressure. No pounding headache. And yet the sinuses, mildly inflamed, subtly swollen, quietly producing just slightly more mucus than they should, are draining steadily and silently, directly down the back of your throat, all day long, sometimes all night too. This is called postnasal drip. And a clinical study published in 2024 confirmed that the average age of patients presenting with this condition is exactly 55 years old. That is not coincidental. The aging changes in immune function, mucosal tissue, and the cilia system we discussed earlier all converge at exactly this life stage to make this condition extremely common in this specific demographic. Now, here's where I want to offer something that I think is genuinely valuable. Because many of you watching have already tried antihistamines, the over-the-counter allergy medications available at every pharmacy. You tried them for a few weeks, maybe felt modest improvement, and then either they stopped helping or the relief was so minimal it was not worth continuing. And you may have assumed that meant allergies were not your problem and moved on. But that is not necessarily what that experience was telling you. Here is a distinction that matters. Antihistamines work by temporarily drying mucus, by blocking a specific chemical pathway in the body. What they do not do is address the underlying inflammation inside the sinus tissues that is driving the excess mucus production in the first place. When the antihistamine wears off, the inflammation is still there. The production ramps right back up. And dried, thickened mucus stuck at the back of your throat is often significantly more uncomfortable than the original thin drainage was. You did not fail antihistamines. Antihistamines failed the problem because they were treating the symptom, not the cause. The approach with the most consistent and well-replicated research support for chronic sinus inflammation is something so simple and so affordable that most people are frankly skeptical when they first hear it. It is regular nasal saline rinsing. A comprehensive clinical review published in 2025 in the journal Medicina, examining evidence across a wide range of conditions affecting the sinuses and nasal passages, concluded that nasal irrigation using a saline solution is an effective, safe, and low-cost strategy for both treating and preventing upper respiratory tract disease. It is currently endorsed as a standard adjunctive treatment by ENT specialists in multiple countries. How does it work? High-volume saline rinses physically flush inflammatory mucus out of the sinus cavities, rather than leaving it there to thicken and drain. They reduce the swelling of the mucosal lining, and, critically, they improve the natural ciliary clearance function we talked about earlier, the very function that is slowed with age. You are essentially giving your body's natural cleaning system a manual assist. But I need to say something here that makes all the difference between this working and not working for you. The single most important word when it comes to nasal rinsing is consistency. 1 or 2 uses will give you 1 or 2 days of modest relief. That is all. The people who report genuine, life-changing improvement from this practice are the people who do it every single day, without exception, for weeks. The cumulative anti-inflammatory effect is what produces lasting change. The one-and-done approach will always disappoint. I will walk you through the precise technique in the action plan at the end, including water temperature, what to add to the solution, and the exact method that maximizes effectiveness. Host smiles warmly. If you are still with us and this is giving you something genuinely useful, type the number 2 in the comments, so I know you are here. And if you have not subscribed yet, please do. Hit subscribe and then hit the bell. Cause 3. Medication side effects, minute 1630 to 2030. The prescription in your medicine cabinet that nobody suspected. Cause number 3 is the one that produces the most visible reaction when I bring it up with patients. Because when someone has been taking a medication faithfully, every single morning, same pill, same time, for months or years, questioning whether that medication could be causing a throat problem feels counterintuitive. It almost feels like a mistake. But this is one of those places where the research is so clear and the clinical impact is so significant for this age group that I would genuinely be doing you a disservice by not explaining it fully. There's a class of blood pressure medications known as ACE inhibitors. The full name is angiotensin-converting enzyme inhibitors. They are among the most widely prescribed medications in the world. They are effective at controlling blood pressure. They are generally well tolerated. They serve a genuinely important cardiovascular purpose for millions of people, but they carry a recognized, thoroughly documented class-wide side effect. It is not rare. It is not unusual. It is simply how the drug works biochemically in a significant proportion of people. ACE inhibitors work partly by preventing the breakdown of a substance in the body called bradykinin. As a consequence of this mechanism, bradykinin accumulates, and in a meaningful percentage of people, studies consistently report somewhere between 5 and 20% of users, that accumulation causes persistent irritation of throat tissue and an ongoing, relentless urge to clear the throat. This is not an allergic reaction. It is not a sign that something unusual is happening in your particular body. It is a direct, predictable pharmacological consequence of how the drug works. Your throat simply happens to be sensitive to the effect that the medication is designed to produce. Here is why this connection is missed so consistently, even by physicians. The side effect does not appear immediately after starting the medication. It can take weeks. It can take months. In some people, it develops a full 6 months to a year after they began taking the drug. So if you started a new blood pressure medication 8 months ago and your throat became persistently bothersome 6 months ago, you and your doctor are likely looking at 2 separate timelines, never thinking to connect them, when in fact they're the same event, separated only by a delay that is entirely normal for this medication class. And it gets more specific than that. A large-scale study analyzing data from more than 27,000 patients found that adults over the age of 65 had a 53% higher likelihood of experiencing this throat-related side effect compared to younger users of the same medication. 53%. This is not a general population finding. This is a finding directly about you, the person watching this video. What can you do about it? First, find out if you actually take a medication in this class. You may not know. Your pharmacist can tell you in under 60 seconds. Bring your medication bottles. Ask directly, is any of these an ACE inhibitor? If the answer is yes, there's an alternative class of blood pressure medications called ARBs, angiotensin receptor blockers. ARBs control blood pressure through a related but distinct mechanism that does not involve bradykinin accumulation. They do not carry the same throat side effect. For many patients, switching from an ACE inhibitor to an ARB resolved the throat symptoms completely within a few weeks. That is a conversation worth having with your prescribing physician. Come prepared. Bring the timeline. Tell them specifically what you suspect and why. Informed patients have better medical conversations than passive ones. If you are still watching, I want you to type the word clarity in the comments right now, because that is exactly what I am trying to give you today. Not fear, not overwhelm, just clear understanding of what may be happening and what you can actually do about it. Cause 4, dehydration, minutes 20:30 to 23:30. The thirst you are not feeling and why that is dangerous. Cause number 4 surprises people not because it is scientifically complex, but because it sounds almost too obvious. Dehydration. And when I bring it up, I can see people thinking, yes, I know, drink more water, and mentally moving on before I have said what actually matters. So let me give you the physiology, because this is not what most people think it is. Mucus is made largely of water. Its consistency, whether it flows and clears freely or sits thick, sticky, and immovable, is directly and immediately determined by how hydrated the tissue producing it is. There is no complexity here. Your mucus behaves the way water behaves. Thin and fluid when you are well hydrated. Dense, viscous, and nearly impossible to clear when you're even mildly dehydrated. Here is an image that might make this vivid. Think of maple syrup poured directly from a refrigerated jar. It moves slowly. It sticks. It does not flow. Now think of that same syrup warmed and thinned with a little water. Completely different behavior. Your mucus is no different. The water content is everything. But here is a specific physiological reality of aging that transforms this from a simple tip into something genuinely important. Research has documented clearly that the thirst mechanism, the body's built-in early warning system for dehydration, becomes significantly and measurably less reliable as we age. A healthy young adult experiences a clear, unmistakable sensation of thirst well before they reach a state of meaningful dehydration. The alarm goes off early. There's time to respond. In older adults, that alarm is muted, blunted. You can be dehydrated enough to significantly affect your mucus consistency, your cognitive function, your kidney function, and your cardiovascular performance, and feel only minimally thirsty or not thirsty at all. The signal simply does not fire the way it used to. What this means in practice is that if you are waiting to feel thirsty before you drink, you are always operating behind the curve. You are in a state of mild, chronic dehydration more often than not, and mild chronic dehydration, maintained day after day, keeps your mucus persistently thick in ways that amplify every other cause we have discussed today. It amplifies the effects of silent reflux. It makes postnasal drip more uncomfortable. It makes ciliary clearance even less efficient than aging alone already has. A practical fluid target referenced widely in clinical nutrition guidelines is approximately 30 milliliters per kilogram of body weight per day, drawn from all fluid sources: plain water, herbal teas, soups, broths, and water-rich whole foods such as cucumbers, watermelon, and leafy vegetables. The critical behavior is deliberate, scheduled, proactive intake throughout the day, not reactive intake in response to thirst. Set a reminder. Keep water accessible in every room where you spend significant time. Make hydration a habit you manage, not a sensation you wait for. Type number 4 in the comments if this is valuable. And subscribe if you haven't. New videos go up regularly. Cause 5. The gut-lung axis, minutes 23:30, 27:00. The surprising connection between your gut and your airways. And now we come to cause number 5. The one that rarely gets discussed in videos like this one. The one that is the furthest from what most people would ever think to connect to a throat problem. And the one that, for a meaningful number of older adults living with persistent mucus, may be the single most important piece of the puzzle. The root of the problem is not in the throat. It is not in the sinuses. It is not in the stomach. It is in the gut. Pause for effect. Let me explain the science here, because this is genuinely fascinating biology. Your digestive system and your respiratory system are not isolated from each other. They share regulatory pathways through both the immune system and the nervous system. And at the center of this connection is the gut microbiome, the trillions of bacteria, fungi, and other microorganisms that live in your intestinal tract and perform functions so critical to your health that researchers increasingly refer to the microbiome as an organ in its own right. When the balance of that microbiome is disrupted, when the diversity and proportion of healthy bacteria is thrown off, researchers call that state dysbiosis. And what the science has established is that dysbiosis does not just cause digestive problems. It activates immune pathways that travel far beyond the gut, including pathways that directly influence how inflamed and how reactive your upper airways are. The immune signals generated by an imbalanced gut microbiome can reach the tissues of your throat and nasal passages and trigger mucus overproduction. Not because anything is physically wrong with your throat, not because you've been exposed to a virus or an allergen, but because your gut is sending inflammatory signals that your respiratory system is responding to as if there were a threat. This pathway has a name in the research literature. It is called the gut-lung axis, and it is one of the most actively studied areas in contemporary respiratory and immunological science. Multiple peer-reviewed studies published in respected journals have confirmed that disruption of the gut microbiome triggers immune responses that promote airway inflammation and increase mucus production. Animal model research has gone even further. When researchers transferred gut microbiome samples from patients with chronic lung disease into healthy mice, those mice showed measurably increased airway mucus production. The gut was directly causing the airway response. The causal link is not theoretical. It has been demonstrated. So what disrupts the gut microbiome? A diet consistently low in fiber and fermented foods. Repeated courses of antibiotics over the years. High sugar and ultra-processed food intake. Chronic unmanaged stress. These are not exotic exposures. And the treatment implication is equally concrete. You cannot fix a gut airway axis problem with a throat lozenge. You cannot fix it with a decongestant spray. You can begin meaningfully supporting your gut microbiome through consistent daily dietary choices. And I will give you exactly where to start in the action plan right now. Important medical notice, minutes 27:00, 27:45. Before I give you the full action plan, I need to take a moment that is important enough that I would rather spend time on it than rush past it. The vast majority of the time, persistent throat mucus in older adults is benign. It is exactly what we have been discussing today. Manageable, addressable, not dangerous. The causes are real, but they are not threatening, and the action steps I am about to give you are appropriate to begin on your own. But your body sometimes uses symptoms to signal something that requires professional medical evaluation rather than self-management. Please schedule an appointment with your doctor promptly if you notice any of the following: mucus that is consistently tinged with blood, even a small or occasional amount; difficulty swallowing that is gradually progressing over time; unexplained weight loss occurring alongside your throat symptoms; a lump or persistent swelling anywhere in your neck; a significant voice change that is not improving on its own over several weeks. These signs go beyond the territory of today's conversation. Please do not attempt to manage them at home. Bring them to your doctor without delay. The complete action plan, minutes 27:45, 30:00. Now, everything we have discussed today comes together here. Specific steps, specific timing, starting tonight. Tonight, step 1, stop eating at least 3 full hours before you lie down. When you eat and recline within an hour or two, your stomach is still actively processing. The valve between your stomach and esophagus is under maximum pressure. Silent reflux is most likely to occur. 3 full hours of upright posture after your last meal is one of the most consistently evidence-supported behavioral changes for reducing nighttime throat acid exposure. Start tonight. This costs nothing. Step 2, elevate the head of your bed. Not with extra pillows under your head. That only bends your neck and can actually worsen matters. Place a firm wedge or folded towel under the headboard legs or the top portion of your mattress. Even a gentle incline of just a few centimeters uses gravity as your ally, keeping stomach acid where it belongs while you sleep. Step 3, drink a full glass of warm water before sleep. This simple act helps maintain overnight hydration levels and keeps mucus thinner during the hours when your body is most vulnerable to accumulation. Warm water is preferable to cold. It is less likely to trigger throat irritation in sensitive tissues. Tomorrow morning, step 4, drink 1 to 2 glasses of warm water before anything else. Before coffee, before breakfast, before your phone, before anything. Overnight, your body has gone 6 to 8 hours without fluid. Your mucus consistency in the morning reflects that. Rehydrating immediately upon waking begins loosening and thinning overnight mucus accumulation before it has a chance to solidify into the thick, coating heaviness most of you describe as your worst time of day. Free, immediate. Tonight you can decide to start tomorrow. This week. Step 5, get a nasal rinsing device from your pharmacy. A squeeze bottle or neti pot. Both work. Use water that you have boiled and allowed to cool to a comfortable warm temperature. Do not use straight tap water. Add a small pinch of plain non-iodized salt. Optionally, a very small pinch of baking soda, which may help thin mucus by gently neutralizing sinus acidity. Use it once every morning. Then give it 2 full, unbroken weeks of daily practice before evaluating whether it is helping. The people who say it did not work almost always stopped after 3 or 4 days. Step 6, schedule a medication review appointment. Come prepared. Before the appointment, write down a specific timeline. When did your throat symptoms begin, and when did you last start or change any medication? Bring that written timeline. If you take a blood pressure medication, Ask your physician directly whether it is an ACE inhibitor and whether an ARB alternative would be appropriate for your situation. Step 7. Add 1 daily fermented food serving. Plain yogurt with live active cultures. Kefir. A small serving of kimchi, sauerkraut, or miso. These foods begin to diversify and support the gut microbiome in ways that research links to reduced airway inflammation over time. This is a long-term strategy, not something that will show results in a week, but it is a kind of long-term strategy that actually shifts your baseline biology rather than just managing surface symptoms. Step 8. Restructure your hydration as a proactive system. Set reminders on your phone for specific times throughout the day. Keep a water bottle in every room where you regularly spend time. Increase your intake of water-rich whole foods. Cucumbers, watermelons, celery, soups, herbal teas. You are not waiting to feel thirsty. You are managing hydration deliberately as a conscious daily practice. Unpopular home remedies. Honey, genuinely soothing for irritated throat tissue, not harmful, can provide real temporary comfort, but it addresses none of the 5 root causes we discussed today. Think of it as symptom management rather than problem solving. Dairy and mucus. The scientific evidence does not support the popular belief that dairy products cause the body to produce more mucus. However, some individuals notice that dairy proteins create a subjective sensation of increased thickness in existing mucus. If you consistently notice this pattern in your own experience, a 2 to 3 week elimination trial is completely reasonable and may be informative. Apple cider vinegar. This one is important. Apple cider vinegar is heavily promoted online as a remedy for throat mucus. But for anyone dealing with silent reflux, which we now know is one of the most common causes of the symptom, introducing additional acidic liquid into an already acid-irritated throat can make matters significantly worse. If you have any reason to suspect silent reflux, please be cautious with this remedy. Closing. The final takeaway. Minutes 29:15, 30:00. Here is what I want you to carry with you when you close this video. That heaviness at the back of your throat has a reason. 5 possible reasons. In fact, and most people living with this symptom have gone months or years, sometimes decades, without having a single one of those reasons properly explained to them. Silent reflux. Traveling up to your throat at night without a single episode of heartburn to warn you. Postnasal drip. Low-level chronic sinus inflammation that never announces itself dramatically. Medication side effects, specifically from ACE inhibitors, developing months after prescription was written and never connected. Chronic mild dehydration, running just below the threshold that triggers obvious thirst in an aging body that no longer sends early warnings. Gut microbiome disruption, sending inflammatory signals from your intestines that your airways are responding to as if there were a respiratory threat. None of these require you to simply accept a life of constant throat clearing. None of them. Each one has a practical, evidence-grounded response. And none of the first steps require a specialist or prescription. They require knowledge, consistency, and a decision to treat your symptoms as a signal worth responding to rather than a nuisance to manage. If someone in your life has ever looked at you and said, "It is just your age, nothing to be done," I hope today gave you a different lens, because you are not simply aging. You are dealing with specific, identifiable, addressable physiology, and you deserve to understand exactly what is happening in your own body. I have a video coming very soon on exactly how gut health connects to the chronic inflammation patterns driving some of the most common complaints I hear from adults in this age group. It builds directly on what we covered today. Make sure you are subscribed and have notifications turned on so you do not miss it. If this video gave you something genuinely useful today, if it answered a question you've been carrying around for a long time, would you share it with one person you know who has been quietly dealing with the same problem? That one share costs you nothing, and it could genuinely change how that person understands their own body. Before you go, leave a comment. Which of these 5 causes surprise you the most? And how long have you been dealing with this? I read every comment personally. This is a real conversation. Your experience matters here. Take care of yourself. I will see you in the next one.